Anish, thank you so much for taking the time with me. I'm so excited to hear about what you're doing with Babyscripts.
Logan, thank you for the opportunity. Always good to talk to you.
So you're innovating in the world of maternal health, and you're bringing to bear some of the best tools in health innovation for moms who are going through pregnancy. Give me that sort of macro view of what Babyscripts is doing right now.
Yeah, Babyscripts is a technology platform, and to put it in one sentence, we do virtual care for prenatal and postpartum. So traditional prenatal care is a lot of knee-to-knee appointments, in-office visits. The reality of the matter is a lot of that can be done outside of the office, outside of the clinic, in the home, in a mobile app, right? And we really sort of set that up, and we have a lot of tools that enable providers to deliver care virtually. Right?
Yeah. So I gotta say, when you founded the company, you founded it with your co-founder Juan Pablo. You were both bachelors, and some news was made over the fact that two young bachelors were creating a company for virtual care for new moms. And you've gone through a journey as a founder, and you are no longer a bachelor.
Yes, I'm no longer a bachelor, and I'm actually very recently a father too.
How recently?
He's turning one in a couple months.
Okay.
So it was actually super interesting. I mean, for the last 5-6 years, I've been in the space, right? And my wife is actually an OBGYN by training.
Okay.
And we have access to some of the best healthcare systems on the face of the planet. But I think the interesting part was, even with all of that, the day I came home with the baby, or just going through that journey itself, it was so clear the gaps, right? And I think postpartum particularly.
So you'd spent years trying to understand the gaps and challenges in that process.
Yeah.
And then finally, 7-8 years later,
you
go through it yourself. What's one challenge that maybe you hadn't fully appreciated prior?
Yeah, well, a couple of nuances here, right? She went through her pregnancy during COVID, and that brought in itself some challenges. For example, I couldn't go in for any of the appointments. So that moment where you learn about the gender or hear the heartbeat, right? There was kind of like an awkward FaceTime every now and then, but it was sort of it was difficult to sort of not be part of that journey with her. Yeah. But I would say, listen, I think the most important thing was, you think a lot about taking care of babies. You read a lot of the books. She was on Babyscripts, right? But I think
that's a good thing.
It's a good thing. Yeah, it's a great thing. Yeah. But I think something as simple as breastfeeding, right? Is you think you know it, and then you come home with a baby, and there's all kinds of issues that come up. Right?
Are there any ways you've tweaked Babyscripts after having gone through the birth of your own child?
Yeah, I think we have, as a company, really honed in on the postpartum time period. I think, some of it was driven by my own experience. I think this is an area where there is massive under-delivery of care, not just in women's health, but I think in all of healthcare. Again, we had largely an uncomplicated pregnancy, right? So I can't imagine if you had a C-section, or if the baby was preterm, or there were other things happening, how much worse things would have been, right? I think, and postpartum is not just that first month. It's actually, you can go all the way to 6 months, right? Yeah. Some people call it the fourth trimester.
I thought it was the first 18 years.
Yeah. Until, then you start writing the checks. That's a different thing, But no, there's a lot there, and we're focusing on various aspects of postpartum care, particularly monitoring, of important vitals and risks in the postpartum time period. One thing that we've spent a lot of time on in the last year is maternal mental health. I think, and a lot of this was also fueled by the pandemic. Mental health is one of the top reasons of suicide for women, right? Particularly postpartum time period. So we're building assessments and tools within the application, and then also alerting the care team if risks come up, right? So it's been a really interesting and honestly humbling journey for me to go through.
I'm guessing when you started pitching the idea of virtual care for prenatal care was a harder sell than it is today. How much of an accelerant was COVID?
Yeah, it was definitely a dramatic accelerant, and a couple reasons why, right? Number one, like in all things telehealth and digital health, there was like an uptick, right? But you look at, pregnancy and the users, they're young, they're tech savvy, they're very naturally, picking up their phone to do stuff, right? They're on Facebook and Instagram all day. So it ended up being kind of a tip of the spear to try a lot of these new things. The second thing, and I tell these people all the time, it's like pregnancy is not an elective procedure, right? So you can't just push that off like a knee surgery, right?
Yeah.
So during the height of COVID, you absolutely had to, it was like a forcing function to adapt a lot of these technologies. So I think like all things digital health, we've definitely seen an increase in adoption, but I think in those initial months, it's over 100% growth month over month. I mean, it's just so much demand, and very thankful that we could help some of our partners and clients to deliver care safely, remotely.
It's something that interested me in early stories, interviews I did with you was the role of virtual care in helping folks in like low access regions. You think about difficulty of accessing an OB. How do you quantify that today?
Yeah, I mean, I think access to care is one of the biggest reasons why the quality of outcomes are so poor in the United States. And it's not just rural America. It's also in highly metropolitan areas. In Washington, D.C., which is where we're based out of, you could be a few miles away, and the difference in outcomes in those zip codes are dramatic, right? Why? Because if you're in Northwest D.C., you can take a train down to a hospital, or you can walk, right? Or if you're in Northeast, it's like 3 buses, and you gotta literally like go over all kinds of hoops just to get to care, right?
Yeah.
So if you can take care out of the hospital and into the home, you make it much more accessible, and people start using it, they start engaging with it, and ultimately that creates more ability to kind of identify risk, and then ultimately allowing care teams to intervene. So it's a big deal. It's a big deal.
I think an interesting progression that I've seen looking at different telemedicine solutions is moving from tolerance of a virtual version of a physical reality to realizations of where it's superior, where they're actually getting additional metrics.
Yeah.
What are some areas where the ability to take daily metrics and to talk to a physician are actually superior to the standard of care prior?
Yeah, and not to go back to postpartum, but that's actually a very good example. So traditional postpartum care, you come in at about 6 weeks postpartum for an appointment. And that's where you might take weight, blood pressure, so for that 6-week time period, there is, really like 1 or 2 data points coming in, right? Yeah. What we also know, and the data shows us this, those 6 weeks is the highest risk for maternal complications, including mortality and morbidity. Most moms die in that postpartum time period. It's unfortunate, but that's where it happens. Yeah. So obviously you want to create as much visibility and resolution as possible in that time period, right? Now the difficulty of, imagine a scenario where mom comes home with a 5-day-old, right? The last thing on their mind is to pack up the bags, take the baby, go back into an office, and it's just not very practical, let alone all of the other access to care issues we just talked about, right? So if you have remote care, you can, at the patient's home, take multiple measurements, right? So it's a difference between, one measurement, in 6 weeks to 100+ measurements, right? So it's literally life or death type of thing, right? Yeah. So very, very powerful stuff, and I don't know, I get very passionate about it, but it just makes so much sense, right?
Yeah.
So.
Last question, what are you most excited about for the next year?
Yeah, I think the next year is, we're going through a transformation. The healthcare industry is going to go through a remarkable transformation in the next 18-20 months. And it is just incredibly exciting to have a fun seat and watch all that happen. I think, 2 years from now, 3 years from now, you compare that to how care was delivered 2 years from 2 years ago,
yeah.
Night and day, right? It's going to be digital first, a very direct-to-consumer oriented care experience, and the pricing dynamics will also change, right? So we're kind of seeing us going from black and white to 4K in front of our eyes, right? That's what's happening in healthcare. And that's a lot of fun. That's a lot of fun.
Exciting.
So.
Anish, thank you for taking the time with me today. It's really exciting to see the ways you're applying technology to help moms. You know, you've been at this journey.
Yeah, we've been around for a while.
For a while now. Yeah. You've stuck to it, and you've evolved, and you've met new challenges, and I just wish you the best.
Logan, it's always fun to hang out with you, and yeah, thanks for having me on. So.
All right.
Cool.